Fibromyalgia really reduces you. You hurt and you become very weak.
There would be days where I was trying to take care of things and felt like a zombie.
And it's like having one foot in life and one foot out. So much of my life is spent alone now.
People can sometimes look at you and think, oh, she's a hypochondriac. She really doesn't have anything wrong with her.
The interesting thing about pain is I can't show it to you. You can't see how much I hurt. And there's only so many words you can use to tell somebody.
They don't see you with a cast or in a wheelchair or having had surgery. You look perfectly fine to me.
There's a switch somewhere that turned my health off. And I've been looking for it to switch it back on for 25 years now.
The typical fibromyalgia patient, from the medical point of view, is a 40-year-old woman with a history of insomnia and a recent traumatic episode like a car wreck or some sort of emotional trauma. Alternative medicine takes that a little deeper and sees the typical fibromyalgia patient as being all of those things, but also we recognize that there are people that typically tend to have a cold, slow metabolism. Their body temperature is low, their body runs more slowly, meaning that they burn fewer calories. Their body tends to be dry skin, dry eye, dry intestine. They tend to be constipated and have a history of chronic insomnia.
Sometimes my
So to assess the 18 points on your client, you'll need to palpate each spot. Technically, the pressure should be 4 kilograms and the point must be painful to be registered as positive, not just tender. You can test these spots in any order that you like. The first spot is located posterior to the greater trochanteric prominence. Here. Another point is at the outer and upper quadrants of the buttocks, just on the anterior part of the gluteus maximus, here. The next spot is on the medial aspect